Good morning, Dr. Richard Buckley here at MilfordMD with our team and our lovely patient who's awake, yes?
Yes.
Yes. Our patients are always awake for everything and always comfortable. This morning's project is a combination project. We are doing lipo-sculpting of the waist. We're doing lipo-sculpting of the hips. That's the part that's above the butt in the back. And we're going to take all that fat that's here and harvest that fat for reuse. When we reuse something that's from one patient going back into that same patient, that's then called autologous because it's their own material. So we're going to be doing autologous fat transfer, also known as fat grafting. Where are we putting it today? Team. Breasts. All right. So we can put it anywhere. We can help to bring back youthful contours to the face. We can help to do Brazilian butt lift, and we can put it all kinds of additional places on the body. A very nice place is in the breast to do natural breast augmentation. It's different from doing an implant. I would say it's a little more modest in terms of what you can do per session. Per session implies that one could have multiple sessions, and we often do just that. So you can't go, for example, from a size A plus, B minus to a double D with fat. If you thought that would be a good idea, you could do that with implants. Choose an implant, as long as it fits, you're good to go. With fat, you can kind of do maybe a cup or a cup and a half size per session, and actually you can do even more on each subsequent session. A cup size is roughly 150 cc's, 175 cc's, something like that. Actually, I very often transfer around 300 cc's when we do fat augmentation. We don't expect that every fat cell we move is in good shape and able to survive the transplant from point A to point B, but a very high percentage of the cells do. And they are as they are, right? You know, if you have fat, you don't want that it just kind of stays there, right? So it's persistent. And if we're putting the fat cells into a place where we do want to have some augmentation, then we do want them to be persistent, and they retain the same quality as from where they came. So those fat cells are forever. And that's a good thing if they're in an area where we want them. So again, to review, today we're doing under numbing of the area we're working on, which is known as tumescent anesthesia. It doesn't need to make a mess. Tumescent means to kind of puff up, plump up. Tumescent local anesthesia, wide awake, comfortable patient. And then we're going to take the fat that comes out of here and we're going to put it in the breasts to augment. Thank you for watching yet another episode of Milford MD.